Hi everyone! If you're a dental student looking to understand the basics of a dental implant procedure, this video is for you. Today, we're breaking it down step by step, from consultation to restoration, so you can confidently explain it and visualize the process. Let's dive in. Step 1. The consultation. The first step is the consultation. The patient comes in with a missing tooth, or maybe they're about to lose one. We start by assessing their overall oral health. This includes a thorough clinical exam, radiographic imaging, usually a CBCT to evaluate bone volume and quality, and discussing medical history to ensure they're a good candidate for surgery. Step 2. Treatment planning. Next is treatment planning. We decide the type of implant, placement position using digital planning software for precision. If there's not enough bone, we might recommend bone grafting or sinus lifts first. Step 3. Implant surgery. Now for the surgical phase. Here's what happens. Local anesthesia or sedation to ensure the patient is comfortable. Incision where a flap is raised to expose the bone. Osteotomy using a series of drills to create the implant site. Implant placement where the titanium implant is inserted into the prepared site, acting as the root of the new tooth. And finally, suturing where the flap is closed over or around the implant, depending on the healing protocol. The surgery is straightforward and usually takes about 30 to 60 minutes per implant, depending on the case. Step 4. Healing phase, also known as osseointegration. After surgery, the implant needs time to integrate with the bone. This process, called osseointegration, takes about 3 to 6 months. During this phase, the bone fuses with the implant, creating a stable foundation for the final restoration. Step 5. Abutment placement. Once the implant is integrated, we attach an abutment. The abutment is a small connector piece that links the implant to the crown. This is a minor procedure and usually involves 1. Exposing the implant if it was submerged, and 2. Placing the abutment and securing it with a screw. Step 6. Final restoration. Finally, we create and place the crown. This step involves 1. Taking impressions either digitally or with a traditional tray. 2. Fabricating the crown in a lab or milling it in-house. And 3. Attaching the crown to the abutment using cement or a screw-retained method. And that's the dental implant procedure in a nutshell. It's a multi-step process that restores both function and aesthetics for the patient. As dental students, understanding each stage is crucial for successful outcomes. Thanks for watching, and if you found this video helpful, don't forget to like, subscribe, and comment below with any questions. See you in the next one.